For your information, I want to go over the type of lens that I selected for my cataract surgery. So let me just read, and you can read along here also. It says most insurance companies and Medicare cover monofocal lenses, which are standard, basic intraocular lenses. And of course, this is if the cataract surgery is deemed medically necessary. However, they generally do not cover premium lenses like multifocal, toric, and extended depth of focus, which can reduce the need for glasses but are considered elective upgrades. You will likely have to pay out of pocket for any costs associated with these advanced lenses. So it is crucial that you confirm your specific plan's benefits with your insurance provider and your doctor before the procedure. Well, I met with my doctor, staff to get evaluated. They looked at my cataracts. I have one cataract in my left eye, or had one cataract in my left eye, and a smaller one in my right eye. And they went over all this with me. Obviously, the monofocal lens is the one that insurance companies will cover. Very little out of pocket. Surgery has to be deemed necessary. So make sure you answer the questions to your benefit when they go over the process with you. What is generally not covered? Well, premium lenses, advanced lenses such as multifocal, toric, and so forth, and also laser-assisted cataract surgery. Now that applied to me, because my doctor, which is the same doctor that I used that did the surgery for LASIK, my LASIK surgery in 2010, Dr. Carlos Manrique from the Rio Grande Valley, has his main office in Edinburgh, office in Harlingen, and I believe he also has an office in San Antonio. So he's well known. Now in my case, I went with the monofocal lens for my left eye. That one had the bigger cataract, and it took a while for my eye to heal. I actually set up the surgery for May 27th of 2025, and 2 weeks later, I was supposed to have the surgery in my right eye. So I did all the procedure with the drops, preoperative care, and all that. And then my surgery was scheduled for the left eye was scheduled on the 27th of May, 2025. It only lasted like 15 minutes. Then I went home to relax, apply the eye drops and so forth. Came back the next day to get evaluated. So we drove all the way to Edinburgh, about 65 miles or so from Bronzeville, Texas. And on the way out over there, my vision was blurry. And that's expected. It's expected to be blurry after surgery for a few days or a week, for some people longer. The other thing, though, that I wasn't expecting is floaters, which a lot of people get them when you get older. The gel in your eyeball loosens up a little bit, and when your doctor is during the surgery, when he's scraping or whatever he does to take the or remove the cataract, more of the gel gets released, and it gets reflected on the retina. And you see it as little dots or little gnats. Now, some people just get a few. Now, in my case, I didn't know about all of this. And I must have had anywhere from 30 to 40 on my left side, because I got the surgery on my left eye first. Again, that was on the 27th of May. Going to Edinburgh, my wife was driving, and all the way through I was complaining about the blurred vision and so forth. And so I don't want to go on and on. So let me just say that I wasn't satisfied. And I knew with time this was going to heal. My eye was swollen and red. And let's see. Let me show you. This is my left eye. This one I think was taken just a day or two after the surgery. It was red, swollen. You could have to apply the drops and so forth. And in time it did get better as the swelling went down and it started to heal. But there was still that blurriness. Not a lot. The one thing I can tell you though is I was able to read stuff like this content that I have here on my screen. I don't have any glasses right now. I can read. So for some reason that standard lens is a fixed distance. So I don't know what the distance is. Like I can see TV from 25 feet. As long as it's a big screen. If it's one of those little TVs, forget it. But anyway, that's what my eye looked like, and the surgery on my right eye was scheduled for 2 weeks from the 27th of May. And even the doctor agreed that to hold off on the surgery because you wanted to make sure my left eye was healed. And I wasn't about to jeopardize my right eye. What would happen? Because I could see pretty good with my right eye. But I said, no, we'll leave it. So we decided to go for in August. Normally, like I said, it was going to be 2 weeks. He set the appointment for August 26th. And then for one reason, I think he was going to be out or something. After all, he couldn't make it. So we changed it to September the 9th. As I record this video right now, it's September 22nd. So I'm going on my second week. On Tuesday, it'll be 2 weeks from the surgery. And that surgery was on my second eye. So getting a little confused here, but finally, September the 9th, a couple of weeks ago, I did the surgery on my right eye, but I decided to go with a premium lens. The premium lens that I got, again, is for far, in between, and near. So right now, it's not 100% yet, but I want to say I have close to 20/20 vision on my right eye. And this is the card that I got after the surgery. Got the card along with some glasses and some other stuff that was in there to help care for the eye. So it's patient lens implant card, Elcon Laboratories. On the backside of the card, it has a serial number. So I would say that if I enter that serial number in a some kind of data bank, it'll probably have my information. But anyway, this is the card that I got for that lens. So getting back to this over here, in my case, monofocal lens for the left eye. But I still had to pay extra because my doctor used laser assistant cataract surgery. If it had been the normal procedure, like I said, most insurances would cover it, very little out of pocket. But in my case, laser assisted surgery, and it was a premium lens. So out of pocket for my right eye only, it was about $4,000. But for me, it's worth it. I mean, I'm getting up in years. I'm just turned 76, so I don't know how long my eyes are going to last. I want to be able to see clear. I'm retired, of course, but I like to play tennis and watch a lot of TV, a lot of sports. I want to be able to see everything clear. And the premium lens is it. Comparing the premium lens to the standard one, it's like that. For me, it's like night and day. And I'm not saying you can't see with the standard lens. I just can see a little better, actually a lot better with the premium lens. So it was a long time that period from when I got the surgery on the first eye on May 27th, and then later on getting the premium lens on my right eye on the 9th of September. A lot of anxiety. I was worried about, well, okay, what's going to happen if things go wrong and stuff like that. Now, when I got the LASIK surgery in 2010, that was different. That was in and out and just the drops and so forth. But with this kind of surgery, for me, I was worried. I go back sometime in October for the final evaluation of my right eye. The left eye, I could get a prescription for glasses for just the left eye, but if my right eye is going to be get as good as I think it is, right now I see pretty good, and it's still swollen. It's still red. I didn't show you my right eye because I didn't take a picture of it, but it's not as bad as the other eye. The other eye, the cataract was bigger. This was a little bit smaller. Now the other thing that I'm really glad is I don't have any floaters on the right eye. If I close my left eye, I don't see floaters. And the floaters that I have on the left eye, it's been June, July, August, okay, over 3 months now. The floaters are getting less and less on my left eye when I have it open. It takes a little gnats in that side. But as time goes on, they're getting smaller and smaller and smaller. One thing I can tell you though, if I had to do it over again, I would have gotten a premium lens for my left eye also, another $4,000. But I think right now, when the right eye heals, it should go to 20/20 for sure. Because I can tell you right now, I go to the garage, I have my chart there, and I check myself, and it's pretty much 20/20 now for me. But and it's not healed yet. I still have some swelling. I still have to take the drops and so forth. So that's pretty much it for this video. If you have the money, I would go with the premium lens. I do want to, just in case you're interested, I do want to show you the pre-op. I won't read this. This is for the right eye, 9/9/2025, surgery Tuesday. And you can read through this the morning of surgery, what to do and not to do, what to do or not to do. You're diabetic, you got glaucoma, need medication, nothing to eat or drink past midnight, the day before the surgery. And like I said, there's a pre-op here before, 2 days before surgery, in my case here. Start applying Prolensa, 1 drop on the eye that's going to be operated on. And of course, you have the registration for the hospital. That's before, of course, all of this. I also had to go to the get a surgery clearance from my doctor, primary care provider. In my case, I had to get an EKG, some blood work, and then the doctor fills up the papers or the forms and faxes them to Dr. Manrique's office, and then you're cleared. So information here, and here are the medications: Moxicine. This is the antibiotic. You can see how often you take it. Use for 1 week, 1 drop 4 times a day, and stop. The other one I used was Lotomax. I'm still using this. We go, I think it's, right now we're doing it 3 times a week. And then on Tuesdays, it goes to 2 times per day. I'm sorry. Yeah, for the week. You can see here. The first time we go from the surgery, 1 drop every 2 hours, and then 1 drop 4 times a day, and then 1 drop 3 times a day. And then for the 3rd week, 1 drop 2 times a day. And then for the 4th week, I'm on the 3rd week right now, starting the 3rd week on Tuesday. 3rd week, 1 time a day. So it's for about a month or so, a little over a month. And then the other one, Prolensa, this one again goes for 1 month, 1 drop a day. We usually do it at bedtime. And like I said, the first one is that's Moxie one is a antibiotic. You need it because of the surgery. Don't want your eye to get infected. The Lotomax and the Prolensa help with the inflammation and the swelling of your eye. And what else do we have here? Manrique custom vision instructions of care after surgery. So here's what they want you to do after surgery. You can read this. So again, for the second eye, right eye, surgery was the 9th of September. Right now, like I said, it's the 22nd of September, 2025. And I'll probably be ready to mow the yard sometime this week. If you have any questions, let me know. Otherwise, thanks for watching. We'll see you next time.